My name is Morgan McDonald. I'm a tech in the emergency room at Baylor Hospital in downtown Dallas. I'm here to talk to you today about the process called triage that you'll find whenever you go to visit the emergency room. Many of us have been patients before, and we've known that when you go to the emergency room, you never know how long you're going to have to wait. There seems to be no consistency with it. Sometimes it could be 1 hour, 4 hours, 6 hours, you never know. But there is a process that the nurses follow, and that process is called triage. Triage comes from the French language, meaning to sort patients. They used this in battle in the old days to differentiate the critical patients from the non-critical patients, so that the critical ones would be seen first and be treated immediately. The non-critical patients could hold off for just a little bit until the critical ones were stable. They use the same process in many ERs, if not every ER. The process, again, triage, to sort the patients. They're given different levels of priority. Those levels are 1 through 5. Level 1 would be your trauma patients, any kind of gunshot wounds or doing CPR. Those sort of things are going to be a level 1, and those will be seen immediately. Level 2 is for any kind of patients that come into the hospital with cardiac problems, that maybe have a very strong history of cardiac issues that we might be a little cautious about. Level 3 is for the patients that come in with maybe an abdominal pain, just kind of started, we're not really sure what it is, so you'll get a level 3. Level 4 is for any kinds of lacerations, stuff that's not too big, just your general cut to the leg, cut to the arm, something like that. The laceration would be given a level 4. For those that don't think that they can wait to go to their doctor the next day and that are there to get their medications refilled, could be something for pain medications or for high blood pressure, those sort of things will get a level 5. Those are the least priority. You can wait till tomorrow to get your medications, but you'd rather go ahead and try to do it tonight. You're going to get a level 5 priority. Whenever you come to the ER and you're given your level, you will then be evaluated by a doctor. Of course, the level 1s will go before the level 2s. Level 2s will go before the level 3s. Level 3s before the 4s, and 4s before the 5s. This way, you get seen and you're in the correct priority that you're there for. The process to be followed, you'll be evaluated by a nurse. They'll determine what you're there for, what kind of history you have. They'll give you your priority, your acuity level, and you'll have a seat in the waiting room, and you'll wait until a bed becomes available for you to be seen. You may think that it's not fair that I've been here for 4 hours and somebody just came in for, heart problems, and they've been here for 30 minutes and they got to go back first. This is because it's called your acuity. You get seen on your acuity. It's not based on your time. It doesn't always seem fair, but that's the process. Every hospital has to have a process. It's not, the nurses aren't just doing it to you just because they can. They're doing it because it's a process that works. I would hate to sit out in the emergency room for 2 hours, possibly be having a heart attack, but we don't know yet because somebody that came in with a level 5 acuity, that decided they wanted to get their medications, they got to go first, and I've had to sit out here. Those are the sort of things that we have to be careful of whenever you go to the emergency room. So we have to base your acuity, very carefully. So please understand that whenever you go, you'll have your acuity level. You'll be told approximate how long you have to wait, and that level can always change. Whenever you are seen by a doctor, they will then evaluate you, and you'll find out if you're going to have to stay in the hospital or get to go home. But the process that the nurses use, again, is called triage. You'll see this in many hospitals, and it's a process to keep the priority in order so that patients can be seen according to their priority, not according to their time. So I hope the next time that you have to go to the hospital, you'll have a better understanding of the process that the nurses are following. So it'll make for a smoother visit, and hopefully you'll be out of the hospital sooner. Thank you very much. Morgan McDonald, my speech 2. Here is my audience.
My name is John Rodriguez, and I'm her brother.
My name's Seth McDonald, and I'm her husband.
My name is Ashley Botenhammer, and I'm her friend.